Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hi, everyone, and welcome back to the Cabral Concept. Thanks for joining me here today on this Motivation and Mindset Monday. Glad to have you with me and really looking forward to today's topic, which was brought up just 2 weeks ago on one of our weekend Cabral host calls. Each weekend, if you haven't been tuning in, that is where I answer our community's questions. We get hundreds of questions that come in, I would say, every month or so, and that is where we start to tackle those questions in the order that they've come in. So it's a service that I love to provide. I love being able to really speak with people all over the world. And the question came in about how long it should take to recover from a wellness-based issue. But today we're going to talk about it from our big five that we typically do speak about. And I also want to go over it as to when to give up on the program that you're on or the relationship or the career or whatever path that you're on, and that you might start anew or you might learn from what you previously, the journey that you were just on, and take that with you to the next step. So that is what I want to dive in today. We're really working with now close to 300,000 client appointments that we've completed. We have a lot of data, and what I want to do is share that data with you. I believe that you're going to be able to take a lot of information away from today's show that you can use in any area of your life. So although my passion and my purpose really revolves around helping people change their body, change their health, change their overall mindset, I do it from the standpoint so that they can do and be anything that they want in life. And that's how I want to approach this here today as well. So when I work with people in private practice, and for the most part, I do want to let you know too, I still see people in my private practice, but the waiting list is quite long. However, what I'm able to do now is really read hundreds of labs every single week. And all those labs come from equilibriumnutrition.com. So I want people to know I read every lab that comes in through that site. And my health coaches are the ones who are implementing those programs, and they're hopping on the phone with people to do those consultations. So, keep in mind that they are amazing in their own right, and they are putting together programs. I'm approving them. I'm saying yes. I'm saying change this, tweak this, come back to me with any questions that you have. So that is how we're now able to work with thousands of people a month rather than hundreds. So that's the goal, and I just want people to know that, up front, so that it allows me to be able to work with more people through a larger team. And I think a lot of people out there right now, they can understand that in their own work, their own line of business, whatever it might be, the way that you're able to affect greater change is to be able to have a great team that you're able to oversee, and then they reach more people and you reach more people as a result. So that's the only way. When I say 300,000 client appointments, I don't mean that I've done that many. I mean that, sure, out of that, I do about 2,000 appointments or so per year. And just over time, of course, that's led to a great number of appointments. For me, it's probably around 35, 40,000 appointments. I think I stop keeping track right around 20,000 or so. So what I want to do is share with you a lot of the road to recovery that people have to go through to getting well, to losing weight, and I would say loving life again. So that could be any area of your life. Towards the end, I'll talk more about relationships. I'll talk more about career, items that I'm familiar with, obviously, in my own life, and then working with so many other people in my practice. But right now, I want to focus on transforming your body and transforming your overall health. So what we do, and what I want you to think about in your own life, is that within 21 days on a program, so the first 21 days, you should actually feel a result. So most people, whether they're doing our 7-14 21-day detox, or they're doing our Candida protocol, or another protocol that puts them on a specific diet plan, like our sensitive gut guide or anything like that, or they're eliminating food sensitivities, they're going to feel a big result. They really are. Within the first 5 days, I should say within the first 7 days, if people are looking to lose weight, they're going to lose about 5 pounds. For people that are on the 14-day detox, they're going to lose about 10 pounds. For people on the 21-day detox, they're going to lose about 15 pounds. Now, there are many people, such as myself, we have our whole community doing the detox next Monday, April 1st. So if you are interested in joining us, we would love to have you, of course. And you can just check that out, today's show notes links. I'm not going to promote anything or name any products today. This is all content-based and information-based. If you ever want more information on products that I do speak about or labs, you can simply go to the podcast page. And today's podcast is at stephencabral.com/1144. So now the detox, though, just keep in mind, or any good elimination plan, anything like that, you don't have to do it for weight loss. I no longer do it for weight loss. About half the people in our community have already reached their weight loss goals. So for me, while I do the 7-day detox, I might lose a couple pounds, although that wasn't my goal. But my goal is to get my body healthier. And it's continued to empty my rain barrel. It's to continue to remove toxins that I get from everyday life. I'm just getting back from vacation and within the next couple of days, and I know that I've had a couple more flex meals than I typically would, a little bit more gluten than I typically would. And what I want to do is basically reset. And that allows me every 12 weeks to hit the reset button. So for a lot of people, they're doing it for wellness, they're doing it for weight loss, but no matter what you're doing it for, by the end of that 21 days, or you might just be doing 7 days, you should feel a lift in brain fog. You should feel lighter. You should feel more energetic. Your sleep should be a little bit better. And of course, if you're looking for weight loss, you should have lost weight. But now what about those people that didn't lose weight in the first 7 days? So we have a few of those people, and we usually say it's about maybe 1 out of 100. And that's what it seems to be in our practice. Now, for those people, their friends around them are losing 5 pounds in a week. Some people lose 6, some people lose 4.5, some people lose 7. And they're saying, why didn't I? My goal was weight loss too. I had 20, 30 pounds to lose. Why didn't I only lose a pound or two? Well, that's what we tell people. We need to go deeper then. That is when there's a true blood sugar, thyroid, adrenal, or estrogen-based issue. That's what we see for the most part. So we run a thyroid adrenal hormone lab. That's what we do. Because those people now need to go deeper. So as I'm telling people the road to recovery, sometimes we need to make a pivot. A lot of times we need to clean up food. That's what we need to do. We need to do a good elimination. We need to do a detox, especially if you've never done one before. You need to eliminate the things that are holding you back within your body. But at times, we have to go deeper. And so for those people, we say that's the next step. Because what most people should do, if they have to lose 20 pounds or more, they should be able to lose 5 pounds or so in 7 days. They should be able to lose a little bit more the next week, maybe like 3 pounds or so. And then the last week, another 2 pounds or so. And then after that, they should be able to lose 1% of their body weight until they reach their goal. And that, again, if you have to lose 20 pounds, that typically will happen within, I would say, 10 weeks maximum. 2 pounds a week on average. That would be the maximum. We see that in our personal training studio in Boston. We see that in our functional medicine practice. So that I can easily back up. But let's say you're someone that has to lose 40 or 50 pounds. Well, you very easily could lose 5 pounds your first week on elimination diet or detox, 10 pounds in 14 days, and 15 plus pounds in 21 days. We see that all the time as well. So we've even seen people lose 21 pounds in 21 days. But remember, your friend might be different than you. Your friend might have to lose 60 pounds or 70 pounds. Or maybe your friend wasn't eating as healthy as you. They were eating pizza and candy, and they were having, all sorts of inflammatory foods. So when they did a detox, they saw even greater results. Of course, right? Because the food choices and the detox lifestyle they were living were basically non-existent, right? They were choosing all poor choices. So don't always compare yourself. It's not apples to apples, right? So you can't always compare yourself to your friends. So what we look for people to do, depending on how much weight they have to lose, most people will lose about 5 pounds the first week because of inflammation and, yes, some body fat, some oxidation there. But we're rebalancing blood sugar, we're rebalancing inflammation. So that's a good first place to start. We like that for most people, but also because the truth is it's a liver-based detox, which means if we're going to start putting supplements in the body, if we're going to start doing new protocols, we want that liver to be detoxified. That simply means that it has less work to do because there's less toxins in the bloodstream, because your liver is what is breaking down those toxins in the bloodstream. And then you're going to remove them through the stool, through bowel movements. That's why we have to make sure that you're having at least 1 bowel movement per day, ideally 2. We're going to be removing those toxins through the urine and then through some sweat and a little bit of exercise through the lungs as well. So that's the first place to start. But again, what happens when you have a setback and your goal is weight loss? Well, we need to then look deeper at those hormones. What else is going on, right? What's preventing you? What's stopping your body from keeping that metabolism elevated? And what's stopping your body from really oxidizing body fat and being able to remove that, again, through the process of burning calories, but you probably already tried that, right? So now what's stopping you from removing that through detoxification? That's what we look at. Okay. So now, when overall wellness, we're saying, let's put weight loss aside because we know we can follow the 5 pounds, 10 pounds, 15 pounds formula for people that are really looking to lose a lot of weight. And for other people, about 5 pounds the first week, then about 2 to 3, then about 2 pounds or so the next week, and then 1% after that until they reach their goal. And that's very, very feasible. If you weigh 150 pounds, what's 1%? Well, it's 1.5 pounds. 1 week you lose 1 pound, another week you lose 3 pounds, but on average, by the end of the month, you've lost 6 pounds, 1.1%, right? Which is 1.5 pounds per week. And I've gone over that before too. So there's previous podcasts on how to lose weight the healthy way. So now, what about people who want to get well? Well, most people will get well. I've said this before. They'll feel a real lift in the first 21 days because, again, they'll have done a detox. They'll have been on the sensitive gut guide. They'll have removed the food sensitivities they found on a food sensitivity lab. And we'll work on that, which is great. And they'll also get a boost from supplements that we're putting in their body that are functional medicine, of course, based, and that replaces a lot of the deficiencies at a blood level right away. So they get a huge boost in the first 3 weeks, which is great. And we speak to most people by follow-up. If you run a lab with us or any practitioner, you really should follow up within 4 to 6 weeks. You should do a half-hour call with them. And the reason is that you're going to have to make a couple tweaks here and there. And we also want to hear how you're doing and what we can do to further support you. Because sometimes you need to make a couple tweaks. That's it. We'll talk about that towards the end of the show. So most people, though, in our practice, we see this. Most people get well in 12 to 16 weeks. What does that mean? Well, if they've come in with headaches and skin rashes, and they've come in with joint pain, they've come in with lower energy, whatever it might be, right? They're usually better within 12 to 16 weeks. What does that mean? What does better mean? Well, better means this. Getting well means this. A lack of symptoms, right? A lack of symptoms. In conventional medicine, what is wellness? Well, wellness means that you don't have anything wrong in your blood work, but that doesn't mean you're well. That doesn't mean you're well at all. That just means there's the absence of disease. So that's why conventional medicine, and again, I'm not taking down any MDs here. MDs out there who are listening to this podcast know there are many. I think you're brilliant. I would love you to just do more integrative health practice. And I know the rebuttal to that is always, well, I only have 15 minutes with each of my patients and I have to be taking my electronic medical records and I need to be doing this, and I've got my malpractice, which means I have to give these medications. Listen, I understand. It's a hard business to be in. And many doctors that I work with, because I have many medical doctors that I see in my own practice, and I know how hard it is. So I understand. What I'm saying, though, when I say conventional medicine, I don't mean you as doctors, I mean the system. So the system says this: wellness is the absence of disease. It means there's nothing wrong in your blood work. Well, that's not wellness at all. That simply means that you don't have a disease. That's the problem I went through when I was younger. I didn't have a disease. I had no diagnosed disease right away. And that's because they weren't even running the right blood work, right? They ran the regular blood work, my cholesterol, which is my lipid panel. They ran my CBC, which is my complete blood count. And they looked at a few other factors, but yeah, those weren't off. I was 17, I was a young kid. So they didn't know what was wrong with me. Well, again, I was still sick, but they said I was okay. Well, I wasn't, just in their eyes, because they were not running functional medicine lab testing. That's a big part of the issue, right? Because if you don't run the right labs, how can you find out what's off? Well, for us in natural medicine, what we say is this, is if there's no more symptoms and your labs look good, you're well. So the first part is this: we need to be symptom-free because we don't rerun labs for about 16 weeks. And that's because we need to work with the person to go through full protocols. Why do we typically say 12 to 16 weeks? The reason is this: that's enough time, and Ayurveda says this as well. They go every 6 weeks. They go every 42 days. And I think I've done a podcast on that. If not, I'll talk about it more in the future as well. Every 42 days, we get a deeper level into the body. Now, how do they know that 6,000 years ago? I have no idea. But we do know now, after 120 days, right? So every 6 weeks is about 42. And then we do that, it's 90. And then another 3 is another 42. So when we're looking at that is we're saying, okay, in about 3 Ayurvedic cycles, or in about 120 days, we've turned over all of our red blood cells. And that's pretty amazing. So now we have new mitochondria and we have a new lipid membrane, and that new lipid membrane can better handle blood sugar, right? So that's why just because you go on a different type of diet doesn't mean it fixes that red blood cell or that bilipid membrane, which is made up of soft and harder fats. And so unless we give it the full 12 to 16 weeks, we're not going to get great results. Now, we tell our people, just because you're symptom free, let's not give up this healthy lifestyle. Let's not go back to our old ways. We can still include a couple of flex meals per week. We can enjoy those foods. But now we can actually get deeper into a healthier lifestyle. We're going to start to wean off of most nutritional supplements. We're going to just stick with our daily foundational protocols for the most part. Maybe we'll add something specific for you. And then we're going to start to maybe ramp up more exercise. Now that you have all that energy and you don't have the joint pain or headaches or skin rashes, we can start to get a little bit deeper on this. So that's what we do. So here's now where we stop though. If you're not feeling better by the end of 12 to 16 weeks, then there's an issue. That's when we need to look at something different. So I tell people that all the time. You should feel a difference in 6 weeks. But honestly, by 12 weeks, you should know that the protocol that you're on is working. So if you're working with a doctor, if you're working with a health coach, if you're working with one of our integrative health practitioners, if you're working with a personal trainer, you should see a difference by 12 weeks. Our personal training programs are 12 weeks long. So that's what we guarantee people. That's what we say. Listen, we're going to help you transform your body. That's what we tell our body transformation people. And this is going to happen through nutrition. And it's going to happen through exercise and healthy lifestyle. We have the whole de-stress protocol. And I'm giving you all this. All of this is in the Rain Barrel Effect. If you haven't read the Rain Barrel Effect, I can't recommend doing that enough. All proceeds, all profits go to charity. I wrote that book to show you exactly what we do in our practice, step by step. I talk about in the book how people get here in the first place, how they get sick, how they put on the weight, how they start to feel low energy and low ambition, low drive, etc. And I want to then teach them then the path to getting that back. And it's not just supplements, and it's not even just diet, right? It's the whole de-stress protocol that I outline in the second half of the book. And it's exactly what we do. Not kind of like what we do in practice, it's exactly what we do. And then I created the Integrative Health Practitioner course and certification to take people deeper along that path. In level 1 of the course and certification, I teach you the de-stress protocol in depth. In level 2, I teach you all the labs that we run for those people who aren't better or aren't feeling better again within that first 21 days or so. So that's what we're really talking about. That's what we're looking at. Now, what about the segment of the population who's not able to lose the weight? They've already done their 12 weeks. They can't even lose 10 pounds in 20 weeks, right? In 12 weeks. Like, what's going on there? They should be able to lose that in 12 weeks for sure. So what's going on? They're following their nutrition. They're doing their exercise. They're doing those things. Okay. Well, for those people that haven't lost the weight, we need to start running labs. And the number one lab for weight loss is a thyroid adrenal hormone. There's no doubt about it. Okay. I love the organic acids test and I love the hair tissue mineral analysis. I love the whole big 5 labs, which are the thyroid adrenal hormone, the hair tissue mineral analysis, the organic acids test. Those 2 are in the starter kit, the food sensitivity test, and the omega-3 test. All of those are amazing for all different reasons. Mineral levels, vitamin levels, inflammation levels from your omega-6 to your omega-3, all your hormones, vitamin D, blood sugar, etc. They're all amazing. But if you can only do them in certain order, thyroid adrenal hormone, first for weight loss, number 1. Okay. Number 2 would be the organic acids test. And number 3 would be the hair tissue mineral analysis. Number 4 would be the food sensitivity test. And number 5 would be the omega-3 test for weight loss. Okay. So let's now take it for wellness. Well, what do we need to do for wellness? Well, let's say you've already run your labs and you're on a protocol and you're just not getting those results. I ask you, what did your intake look like when you first came in and what did it look like after? So right now, one person I'm working with, and I always work with the hardest of the hard people, that's my pleasure and also my challenge, is that they got rid of their tinnitus, they got rid of their joint pain, they got rid of all of the symptoms. I'm not going to go through them all. They got rid of them all, except they don't feel the increase in energy and the lift in brain fog yet. So we're getting there, but they still haven't gone after, and they still haven't gotten rid of. They got rid of the loose stool. They got rid of all these things, but they haven't got the energy back. And that is at the deepest level. So in Ayurveda, they talk about that from a muscular level, a nervous system level, and they call it a fertility-based level, basically. So that's at the deepest levels. And so I tell them, listen, most people are better by this time. There's no doubt about it. But remember, there's something called myalgic encephalomyelitis, also sometimes known as chronic fatigue syndrome. And it's flu-like symptoms. It's brain fog. It's inflammation. It's a dysregulation. Most people don't know this, but it's a dysregulation of the autonomic nervous system. And the autonomic nervous system is made up of the fight or flight, and it's made up of the rest and relax, the parasympathetic nervous system, but it's also made up of, or at least stimulated by, the central nervous system and peripheral nervous system. That means that we really have to be careful with a lot of our input. This person has a go, go, go high stress job. They're still exercising. We just have to make the decision like, what can we take back? What can we relax in other areas of the life in order to bring in more energy? I always tell people this. If your issue is energy, you need to look at everything in life as this. Is the activity I'm currently engaged in right now bringing in energy to my body, or am I giving out energy? Even if I feel great, am I giving out energy? That's what I ask, because basically we can't run a deficit, and we're already running a deficit. So if work drains you of energy, we have to say which parts of work are the most draining. Can I scale back on those? Because I know most people can't give up on work, although I know some people with ME have. Okay, so then I say, what about your exercise? Is your exercise bringing in energy or giving out energy? And if the answer is it's giving out energy, well, I need you to do this. I need you to look more towards Qigong, Hatha Yoga, meditation, anything that's just bringing in energy, light walking, that's it. And then we'll use a graduated exercise program. And I've talked about that before, my 4 phases of exercise. And I teach this in the IHP program. That starts with walking. That starts with a little bit of cardio. It just brings that body back to life, right? That's what we do. So what we do is we work on gradual programs. Now, the people that I work with myalgic encephalomyelitis, the chronic fatigue, the HPA axis dysfunction, what we're doing is we're looking at 10% improvement per month. So I ask those people by month 4, and I don't put the nocebo effect on their head. They might be better in 4 months because it's all based on levels of wellness, right? Of fatigue. So at that point, I ask them, here, do you feel 10% better this month? And they might. What about 20? Yes, but they're not fully better. No, they're not yet, but they're on that path. So I ask you this, no matter what you're doing, who you're working with, are you on the path? Do you start to see yourself gradually improving? And if the answer is yes, then be patient. Continue to push forward. Continue to follow the path. I know it's not happening as quickly as you would like it to, but it's happening. And now remember, once you are well, if it is taking 10%, you're better in 10 months. Then you have the rest of your life. That's the thing. You have the rest of your life to enjoy this newfound wellness. Or let's say you have the hardest time with weight loss. We have one person in our practice, super hard for them to lose weight. They haven't been able to lose weight for 30 years. We can't come in and say, well, you're going to lose weight in 21 days. There are layers to this. We have to peel back that onion. We need to remove the heavy metals. We need to remove the mold and candida and SIBO and anything else that's there. We need to get the body healthy, because a healthy body is one that can't be overweight. But a body that's sick, it's going to hold on to that weight. It's a survival-based mechanism. So we're trying to just get this person healthy, get them healthy, focus on health, and then the body will be more willing to part with the weight. So if you're struggling with that right now, maybe you're looking at it from the wrong angle. Maybe you're trying to punish your body with hard exercise. You're trying to punish your body with no carbohydrates, telling it that it must lose weight. You're trying to force it to. Well, remember, the body will fight back too, because it's its own living organism, and its job is survival. And right now it's holding on to that weight for survival. For whatever reason, we won't necessarily know until we do run those labs, until we look deeper into this. So what I want to say is there are times when you're going to have to be a little bit more patient, only if you have something that's a little bit more serious. So for people that are dealing with headaches or loose stool or constipation or digestive issues, yes, you should be feeling pretty much better, if not all better, within 12 to 16 weeks. But people who have debilitating rheumatoid arthritis or other autoimmune-based issues, it might take just a little bit longer. But even you with autoimmune disease, Hashimoto's, rheumatoid arthritis, sarcoidosis, MS, you should start to feel that gradual lift within that 12 to 16 weeks for sure. Now, I want to give a couple other things because people asked about this. What if you're someone that does not tolerate supplements very well? What if you have Lyme disease, or you have SIBO or candida or bacterial overgrowth or parasites, but yet you get nauseous and sick when you take supplements? You have to understand is that we know the protocols. A good practitioner will know what to do to get you well, but sometimes they don't know how to pivot. And that's why I want to give all practitioners out there exactly what we do. that we've seen work really, really well. So we have our Candida and bacterial overgrowth protocol that many people are doing because they've run an organic acids test or stool test or food sensitivity test, and they've seen the Candida overgrowth, the yeast fungal overgrowth, they've seen mold overgrowth, or they've seen bacterial overgrowth. And before we do our mold protocol, we do the Candida bacterial overgrowth protocol. So what we're doing is we're giving people 3 specific supplements each month for 3 months. And they are biofilm disruptors, they're antimicrobials, they are gut replenishers. But we're doing this in a very specific way. And we've really fine-tuned this now over a decade, and it works incredibly well. And we know it works because we run the before and after labs. I'm teaching that now in level 2. Like, here's the before lab, here's the after lab, here's the great results they get. And so, but you have to understand is that doesn't mean that that's going to work for every person. Now it will. We know that the products work. The problem is that the person is so sensitive, they're not able to take the products. That was me many years ago. So what I found was this. You stop. When a person has a bad reaction, you stop all of the supplements. And then you add one product back in. And you only use that one product for 3 days. And you say, is there a good reaction or no reaction at all? Or is there a negative reaction? And if it's a negative reaction, we stop the product again for 3 days. And then we introduce it at just one of the 4 capsules. A typical dose might be 4 capsules. We only use 1 capsule, that's it. And we take that with dinner or we take it before bed. We don't take it during the day because we know that it might cause them brain fog, et cetera, et cetera. So we take it at night. And we say, does that work? Yes, 1 capsule works. Good. The next day we tried 2. Does that work? And the answer is yes. If it takes day 3, of course, then we do it. And then 4, we work up to 4 capsules. Maybe the body just had to get used to that herb and it couldn't do it all at once. Okay? That's a possibility. Some people also just have such tremendous die-off that they need to draw back a little bit. It's working, but they feel it as loose stool or nausea or vomiting or whatever it might be. And so again, it's only 1 out of 100 people, but we still do it. So we stop and we say, okay, now we've titrated. It's called titration. We've eased back in 1 supplement. Now we move on to the next. Every 3 days, we just do the next one. And we do the next one. And if there's one that really doesn't work, no problem. Then we take that one out. But we found it because we've done them individually. So remember, there's hope for every single person. You just have to know how to do these specific things, which is why I try to share this with you every day on the Cabral Concept, 1,144 shows later. Each trying to cover a little bit different topic, a little bit different area. And that's why I truly invite you to go back and listen to the previous shows. I know there's a lot, but that you have time, right? You can listen to them throughout the day, whenever you want. And it will teach you about health. It will teach you about life that I've learned, right? That I'm now passing on to you with the experience that I have now. And that's why I know these things. I would not have been able to give you these exact protocols a decade ago, but I can now. And so I've waited and I've taken the time to see what works so I can pass it on to you, knowing that there is hope for you. There's hope for everyone. You just can't give up. You have to understand is that the timeline is sometimes different than what you expected, but the result should never be. If your goal is to transform your body, that can't happen. If your goal is to get well, it will happen. If your goal is to develop the perfect relationship, it will happen. If your goal is to develop the ideal career that you love doing, that you're passionate about, it will happen. If your goal is to move towards a more and deeper spirituality, so you feel more purpose, you feel more passion, you feel more connectedness with what you're doing in the world, it will happen. But sometimes, and I know we want it to happen yesterday, it doesn't happen according to our timeline. And we've set the goal, we've set the deadline, and we say it has to happen. Oftentimes, what I found, especially with me, is it causes more stress. I no longer do that. Now I set in my mind, the mind's eye we call it, right? We set it for what we want to achieve in life. And we say, there could be obstacles. Typically going from point A to point B in terms of when we're looking at for wellness or weight loss or life, it's not a straight line. There are zigzags. By the time we have to finish all of our pivots, maybe it's been 7 or 8 different pivots. But no matter what, just like I mentioned at the beginning of the show, we're learning along the way. So if you have to change protocols, if you have to change practitioners, coaches, personal trainers, whatever it might be, don't despise the person or the protocol you just did. You learn from it. You learn one more thing that might work a little bit, or that you could take something from that's positive, stay positive, that can move you to the next goal. What you don't want to do is stress out. You have to understand is that the only reason you're not at your goal right now is most likely a lack of knowledge. And I don't say that from a negative way. It's either a lack of knowledge or it's just time. When you're on the right protocol, when you found the right protocol, it still takes some time. Our best people, yes, they feel alleviation in 21 days, but it takes 12 to 16 weeks. And then what about those people with ME? Or what about the people that are 100 pounds overweight? Doesn't happen in 3 months. It takes a little bit more time. But along the way, you're moving to your goal. You can see it happening. Yes, there are obstacles again, and you have to stop, you have to reassess, and then you have to get back moving forward. But that's part of life, right? I mean, that's the amazing thing is that, okay, so you reach your goal. Great. Hopefully, you've changed as a person along the way so that you have a deeper appreciation, that you have more gratitude, so that you don't ever fall back into the type of person that gained all the weight or got sick or had the poor relationship or really despised their career or didn't have the spirituality. You're doing the work along the way, not just on your body, but on your mind. Because if you never work on the mind, you're simply destined to repeat all of the mistakes of the past and fall back. And we see that sometimes. We see people try to believe that they can just go back to their old ways with their new body or their new health. And it doesn't happen that way. And it shouldn't. Because hopefully along the way you've grown. Not just changed the body, right? But you've actually now changed your life. That is the tagline of the Cabral concept. Change your body, change your life. It took me many years to get well. Now I can look back. It's hard, right? It's hard at the time. It took me a decade to get well. If I had met someone who had done the things like my mentor 10 years later, I would have been well in 12 to 16 weeks. Maybe a little bit longer because I did have Addison's disease. Yeah, it might have taken me a bit longer. I understand that. But it wouldn't have taken as long as I did now. However, sometimes maybe things really do happen for a reason. Who knows? But I can tell you this. I wouldn't have read the thousands of books. I wouldn't have probably committed to going back to school, to really traveling all over the world to see what works. I probably wouldn't have done that. And I probably then wouldn't have had this podcast today. I wouldn't get to speak with so many people, work with so many great people all over the world. So sometimes you never know why you're going through the challenges of the day. Keep that in mind. You never really know. And oftentimes you don't even know until you look back. Now I look back and say, wow, I'm kind of glad that all of that happened. It's crazy to say that, but now I feel different. And so you have to understand, you have to keep yourself open, that you may feel different about your entire journey up until the point that you achieved your goals, or ideally right now, so that you can feel the feeling of what the person inside of you is going to feel like and be like living their new life. If you do that, it's only a matter of time. That's all it is. Thank you so much for joining me here today on this Motivation and Mindset Monday, one of my favorite shows to be able to do for personal reasons myself, and hopefully it's been able to touch you in some way as well. If it has, please do feel free to pass this show along to anyone else it could serve. Ever wonder what the best sauna, blue blockers, sleep trackers, wake lights, salt lamps, or other health gadgets are? Or what about the top non-toxic mattresses, sheets, soaps, bath products, toothpaste, and cookware? Or would you like to know the cleanest choices for hemp parts, meal delivery services, supplements, and much more? I personally curated, researched, and now created a resource page of all of my top picks that continues to grow each week. These are the exact products I use in my own life, with my family, in my private practice, and they're the ones I trust. To find out all of my up-to-date recommendations and all the details, simply head on over to stephencabral.com/resources.